Stroke is characterized by sudden paralysis or weakness, typically affecting one side of the body. Common symptoms of stroke include weakness in the face, arm, or leg. Stroke occurs due to interrupted blood flow to the brain. Interrupted blood flow deprives brain tissue of oxygen and nutrients. The severity of a stroke depends on the extent and location of the brain damage. Prompt medical intervention is crucial to minimize long-term effects of stroke. Heart disease can manifest as chest pain or pressure. Chest pain associated with heart disease is often described as squeezing or tightness. Cardiac-related chest pain may radiate to the neck, jaw, shoulder, or arm. The radiating pain pattern helps identify potential heart-related health issues. Speech difficulties, including slurred speech, are common symptoms of stroke. Stroke-related speech problems can manifest as an inability to speak altogether. A stroke can cause a person to struggle to find the right words to express themselves. Stroke victims may also experience difficulty understanding the speech of others. Shortness of breath is a common symptom of heart disease. This symptom often occurs during physical exertion. Shortness of breath can also manifest when lying down. These symptoms indicate the heart's difficulty in effectively pumping blood. Inefficient blood pumping leads to shortness of breath. Stroke can induce sudden vision loss in one or both eyes. Double vision, or diplopia, is another possible visual consequence of stroke. These visual impairments result from disrupted blood supply to the visual centers of the brain. Reduced blood flow deprives the brain's visual processing areas of essential oxygen and nutrients. Palpitations are characterized by a racing, skipping, or fluttering sensation in the chest. Irregular heartbeats can manifest as palpitations. Palpitations can signal underlying heart rhythm abnormalities. Heart rhythm abnormalities can be identified through medical evaluation. Seeking medical advice is crucial for diagnosing the cause of palpitations. Dizziness can be a symptom of stroke, indicating brain dysfunction. Loss of balance is a potential indicator of stroke. Coordination difficulty may signal a stroke event. Stroke symptoms arise from a lack of oxygen supply to the brain. Brain dysfunction results from oxygen deprivation during a stroke. Prompt recognition of these symptoms is crucial for timely intervention and treatment. Swelling in the ankles, legs, or abdomen can indicate heart failure. Heart failure occurs when the heart cannot pump sufficient blood to meet the body's needs. Fluid accumulation due to inefficient blood circulation leads to swelling in dependent body parts. Compromised cardiac function reduces the body's ability to effectively circulate fluids. Edema, or swelling, is a common symptom of heart failure resulting from fluid retention. A sudden, severe headache without a known cause may indicate a stroke. The presence of neurological deficits alongside a severe headache increases the likelihood of a stroke. Neurological deficits can include sudden numbness, weakness, or difficulty speaking. Prompt medical evaluation is crucial when experiencing a sudden, severe headache with accompanying neurological symptoms. Persistent fatigue and lethargy, even after adequate rest, can indicate underlying health issues. Heart disease can manifest as fatigue due to the body's struggle to receive sufficient oxygen and nutrients. Reduced oxygen and nutrient delivery impairs cellular function, leading to feelings of tiredness and weakness. The heart's inability to pump efficiently results in systemic oxygen deprivation and subsequent fatigue. Consulting a healthcare professional is crucial for diagnosing and managing fatigue related to potential heart conditions. Loss of consciousness in stroke patients indicates severe brain damage. Severe strokes can lead to widespread brain damage, resulting in loss of consciousness. Immediate medical attention is crucial when a stroke causes loss of consciousness. The severity of a stroke is directly related to the extent of brain damage and the resulting loss of consciousness. Dizziness or fainting can indicate underlying heart disease. These symptoms often arise from reduced blood flow to the brain. Reduced blood flow deprives the brain of necessary oxygen and nutrients. Heart conditions affecting blood circulation can lead to these episodes. Consult a healthcare professional for evaluation if experiencing these symptoms. Dysphagia or difficulty swallowing can occur following a stroke. Post-stroke dysphagia increases the risk of choking. Aspiration pneumonia is another potential complication of dysphagia. Effective management of dysphagia is crucial to prevent complications. Nausea and vomiting can be indicative of a heart-related issue, especially when accompanied by chest pain. The correlation between nausea, vomiting, and heart issues is more pronounced in women. Elderly individuals also exhibit a higher risk of heart-related issues presenting as nausea and vomiting. Prompt medical evaluation is crucial when nausea and vomiting are coupled with chest pain. Ignoring these symptoms can lead to delayed diagnosis and potentially adverse outcomes. Understanding these atypical symptoms is vital for timely intervention and improved patient outcomes. Numbness or weakness on one side of the body can indicate a stroke. Stroke symptoms require immediate medical assessment to minimize potential damage. Prompt diagnosis and treatment are critical in stroke management. Unilateral numbness or weakness affects motor control and sensory perception. Rapid intervention can significantly improve stroke outcomes and reduce long-term disability. Stroke assessment involves neurological examinations to identify specific deficits. Pain experienced in the shoulder, neck, jaw, or back can sometimes be referred pain originating from the heart. Referred pain is particularly significant during a heart attack. The body's interconnected nerve pathways can cause pain signals from the heart to be misinterpreted in other areas. Prompt recognition of referred pain can be crucial for timely diagnosis and treatment of cardiac events. Understanding referred pain patterns aids in differentiating cardiac-related discomfort from musculoskeletal issues. The acronym FAST is used to quickly identify the symptoms of a stroke. FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. Face drooping refers to the sudden weakness or drooping of one side of the face. Prompt action is crucial. Time to call emergency services immediately upon recognizing these symptoms. The F in FAST is an acronym used to quickly identify stroke symptoms, with F standing for face. The F in FAST prompts a check for facial drooping or asymmetry. Observe the person's face when they smile to assess for potential facial weakness. Facial drooping or asymmetry during a smile can be a critical indicator of a stroke. Prompt recognition of facial drooping is crucial for timely medical intervention. The A in FAST stands for arms, a key indicator of potential stroke. To assess arm strength, instruct the person to raise both arms simultaneously. Observe if one arm drifts downward involuntarily, which suggests possible muscle weakness. Downward drift indicates a potential neurological issue affecting motor control. Prompt and accurate arm assessment is crucial for timely stroke intervention. The S in FAST stands for speech. Slurred speech is a key indicator to assess. Difficulty understanding speech is another critical symptom. Assess if the person's speech is slurred or difficult to understand. Impaired speech is a sign that requires immediate attention. Prompt recognition of speech impediments is crucial for timely intervention. The T in FAST stands for time, emphasizing the critical need for a rapid response. Immediate action is crucial when stroke symptoms appear to minimize potential brain damage. Calling emergency services immediately ensures the fastest possible medical intervention. Prompt treatment significantly increases the chances of a positive outcome following a stroke. Early stroke treatment significantly reduces the risk of long-term disability. Time is a critical factor in stroke treatment and recovery. Prompt medical intervention can minimize neurological damage caused by stroke. Rapid treatment helps preserve brain function and improve patient outcomes. Delays in treatment can lead to irreversible brain damage and permanent disabilities. Immediate action is essential to maximize the benefits of stroke treatment. Prompt medical attention for heart disease can significantly reduce the risk of severe complications. Early intervention in heart disease management can improve the patient's overall quality of life. Timely treatment helps prevent the progression of heart disease to more advanced and life-threatening stages. Seeking immediate medical care at the onset of symptoms is crucial for effective heart disease management. Preventative measures, combined with timely medical intervention, are key to combating heart disease. Stroke symptoms can sometimes disappear temporarily. The temporary disappearance of symptoms does not mean the danger has passed. Immediate medical evaluation is crucial, even if symptoms subside. Ignoring stroke symptoms, even if temporary, can lead to severe consequences. Prompt medical attention significantly improves the chances of recovery from a stroke. Subtle heart disease symptoms can be easily overlooked or dismissed. It is crucial to pay attention to any unusual physical discomfort. Early detection and awareness of symptoms are essential for timely intervention. Ignoring potential symptoms can lead to delayed diagnosis and treatment. Consulting a healthcare professional is recommended for persistent or concerning symptoms. High blood pressure is a significant risk factor for stroke. Elevated cholesterol levels contribute to the risk of stroke. Smoking is a major modifiable risk factor for stroke. Diabetes increases the likelihood of stroke. Managing these risk factors can reduce the probability of stroke. High blood pressure is a significant risk factor for heart disease. Elevated cholesterol levels increase the risk of developing heart disease. Smoking is a major modifiable risk factor contributing to heart disease. Obesity significantly elevates the risk of heart disease. A family history of heart disease increases an individual's risk. Managing risk factors can significantly reduce the likelihood of developing heart disease. Maintaining a healthy lifestyle can significantly reduce the risk of stroke. Regular exercise contributes to a healthier cardiovascular system, lowering the probability of heart disease. A balanced diet provides essential nutrients that support optimal heart function and reduce stroke risk. The synergy between exercise and diet creates a protective effect against both stroke and heart disease. Adopting healthy habits is a proactive approach to long-term cardiovascular and neurological well-being. Regular medical checkups are crucial for identifying potential health risks. These checkups aid in the early detection of risk factors associated with stroke. Medical checkups also play a vital role in managing risk factors for heart disease. Early identification allows for timely intervention and management of these risk factors. Managing risk factors can significantly reduce the likelihood of developing stroke and heart disease. Proactive checkups contribute to overall health and well-being by addressing potential issues early. Recognizing the warning signs of stroke enables timely intervention. Prompt action following stroke warning signs can significantly improve patient outcomes. Understanding heart disease warning signs allows for early diagnosis and management. Early detection of heart disease can lead to lifestyle changes and medical treatments that reduce risk. Knowing the difference between stroke and heart disease symptoms is crucial for appropriate response. Empowering individuals with knowledge of these warning signs can save lives. Stroke occurs when the brain's blood supply is interrupted or reduced. This interruption deprives brain tissue of essential oxygen and nutrients. Reduced blood flow leads to brain cell damage and potential loss of function. Timely restoration of blood flow is crucial to minimize long-term brain damage. Heart disease includes various conditions affecting the heart structure. Heart disease also encompasses conditions that impair the heart's function. Structural heart conditions may involve valve defects or congenital abnormalities. Functional heart conditions can include arrhythmias or heart failure. Understanding both structural and functional aspects is crucial for diagnosing and treating heart disease. Ischemic stroke is the most prevalent type of stroke. Ischemic stroke is caused by a blood clot obstructing an artery leading to the brain. The blockage of an artery deprives brain tissue of oxygen and nutrients. Prompt medical intervention is critical to minimize brain damage during an ischemic stroke. Common risk factors for ischemic stroke include hypertension, high cholesterol, and smoking. Coronary artery disease is a prevalent type of heart disease. This condition is primarily caused by the buildup of plaque within the arteries. Plaque accumulation leads to the narrowing and hardening of arterial walls. The narrowing of arteries restricts blood flow. potentially leading to heart complications. Early detection and management are crucial in preventing severe consequences of coronary artery disease. Hemorrhagic stroke is characterized by the rupture and subsequent bleeding of a blood vessel within the brain. The primary cause of hemorrhagic stroke is the weakening of blood vessel walls, leading to rupture. Blood release from the ruptured vessel increases pressure within the brain, damaging brain tissue. Hemorrhagic stroke can result in a range of neurological deficits, depending on the location and extent of the bleeding. Prompt medical intervention is critical to minimize brain damage and improve outcomes in hemorrhagic stroke. Diagnostic imaging such as CT scans and MRIs are used to identify and assess hemorrhagic strokes. Heart failure occurs when the heart is unable to pump sufficient blood to meet the body's metabolic demands. This condition results from the heart's inability to adequately supply oxygen and nutrients to vital organs and tissues. Reduced cardiac output leads to insufficient perfusion of organs, causing fatigue, shortness of breath, and fluid retention. Heart failure can be caused by various factors, including coronary artery disease, hypertension, and valve disorders. Transient ischemic attacks, TIAs, are often referred to as mini-strokes. TIAs produce stroke-like symptoms, such as temporary weakness or speech difficulty. Unlike strokes, TIAs do not cause permanent brain damage. TIA serve as warning signs for potential future strokes. Prompt medical evaluation following a thanks in advance is crucial for stroke prevention. Arrhythmias are characterized by irregular heartbeats. These irregular heartbeats can manifest as heart rates that are too fast. Irregular heartbeats can also manifest as heart rates that are too slow. Erratic heartbeats represent another form of arrhythmia, characterized by unpredictable rhythms. Arrhythmias encompass a range of conditions affecting the heart's rhythm and regularity. Stroke diagnosis utilizes imaging technologies such as CT scans to visualize the brain. Magnetic resonance imaging, MRI, provides detailed brain images for stroke assessment. CT scans and MRIs aid in the rapid identification of stroke-related brain abnormalities. Imaging tests are crucial for determining the type and extent of stroke damage. Visualizing the brain via CT scans and MRIs enables timely and effective stroke management. Heart disease diagnosis often involves the use of electrocardiograms, ECGs. Echocardiograms are also crucial diagnostic tools for assessing heart health. ECGs record the electrical activity of the heart to identify abnormalities. Echocardiograms use sound waves to create detailed images of the heart's structure and function. Stroke treatment options include clot-busting drugs to dissolve blood clots. Surgical procedures can be employed to physically remove or bypass blood clots, obstructing blood flow to the brain. Restoring blood flow to the brain is the primary goal of acute stroke intervention. The speed of intervention is critical in minimizing brain damage and improving patient outcomes. Both pharmacological and surgical interventions aim to re-establish adequate cerebral perfusion. Heart disease treatment encompasses medications, lifestyle adjustments, and surgical interventions. Medications manage symptoms and slow disease progression. Lifestyle changes include dietary adjustments and increased physical activity. Surgical procedures address structural heart problems. Treatment plans are tailored to individual patient needs. Regular monitoring is essential for effective heart disease management. Rehabilitation is a crucial component of stroke recovery. Rehabilitation helps patients regain lost function after a stroke. The goal of rehabilitation is to improve the patient's quality of life. Rehabilitation involves a variety of therapies tailored to individual needs. Consistent effort and dedication are key to successful rehabilitation outcomes. Cardiac rehabilitation assists patients in recovering from heart disease. Cardiac rehabilitation aims to improve overall heart health. The rehabilitation process involves structured exercise programs. Nutritional counseling is a key component of cardiac rehabilitation. Stress management techniques are taught to reduce strain on the heart. Stroke prevention involves managing modifiable risk factors. Effective management of high blood pressure is crucial for stroke prevention. Controlling cholesterol levels is another key component of stroke prevention strategies. Lifestyle modifications, including diet and exercise, play a significant role in managing these risk factors. Regular medical checkups are essential for monitoring and managing stroke risk factors. Heart disease prevention involves maintaining a healthy lifestyle. Managing risk factors is crucial in preventing heart disease. Regular physical activity helps maintain a healthy cardiovascular system. A balanced diet, low in saturated fats and cholesterol, supports heart health. Recognizing the warning signs of stroke is a crucial first step in saving lives. Common stroke warning signs include sudden numbness or weakness, especially on one side of the body. Heart disease warning signs may include chest discomfort, shortness of breath, and pain radiating to the arm or jaw. Prompt medical attention significantly increases the chances of survival and reduces long-term disability from stroke and heart disease. Prompt medical intervention correlates with improved patient outcomes. Immediate medical attention can significantly reduce the severity and duration of illness. Seeking timely medical care can prevent complications and long-term health issues. Rapid response in medical scenarios can be life-saving. Education about medical conditions empowers individuals to take proactive measures. Informed individuals are better equipped to manage their health and well-being. Knowledge sharing fosters a supportive environment for those affected by medical conditions. Understanding medical conditions promotes early detection and timely intervention. Collective action, driven by education, can improve healthcare outcomes for all. Regular medical checkups are crucial for the early detection of potential health risks. Early detection through checkups allows for timely intervention and management of health conditions. A healthy lifestyle significantly reduces the risk of developing stroke and heart disease. Maintaining a balanced diet supports cardiovascular health and minimizes risk factors. Regular physical activity strengthens the heart and improves overall circulatory function. Avoiding smoking and limiting alcohol consumption are essential components of a heart-healthy lifestyle.